My book looks at how we've talked about healthcare reform since the late 1960s to the present day. I'm really trying to get a handle on how Americans think about the healthcare system and how that shapes the policies that we pursue. Well, this book was a bit like an itch. I had to scratch it. Back in the early 90s, I started to read a lot of accounts of why we hadn't enacted national health care. And it just didn't make a lot of sense. And it wasn't that the explanations were wrong, I just thought they were incomplete. Most people who looked at the issue focused on either institutions, talk about Congress, for example, talked about separation of powers, checks and balances, and those are important things. A lot of other folks talked about culture. Americans are individualists, they distrust government, and that's true too. Some people looked at interest groups. You can say, oh, doctors don't want healthcare reform, hospitals don't want healthcare reform, and that's true too. But no one had really looked at how we talk about reform and the language we use and the symbols we use. And so for me, that was a real missing element of the debate, and that's what my book is really trying to explore. This really goes back for me more than a decade. I started doing some initial reading on this in the late 90s and have been actively working on it since 2002. So it's a full decade here of my time at PC that has been dedicated to this. And in terms of researching the book, what I did was really look at a lot of different things. Everything from newspaper articles, television coverage, Hollywood films, shows like ER, Grey's Anatomy, you name it. This book has kind of cast a pretty wide net to look at the ways we present healthcare and the need for healthcare reform in America. Well, I think, again, the focus on language really is the basic difference for me. What I'm trying to do is to help people understand that the words we use matter. And the most important word in this book, which is actually in the title, is crisis. And that's the connective tissue that I found in looking at 40 years of healthcare conversations in this country. Everyone has described the system as in a state of crisis. And just on a basic level, that didn't make a whole lot of sense to me, because a 40-year crisis doesn't really add up. A crisis is usually something that's a short-term event. It's an acute event. Yeah, I like to think about the comparison to, say, a heart attack is a crisis. It's a medical crisis. And you go to the emergency room and they provide you with treatment that saves your life, and there's a fix. The difference for me in looking at healthcare reform is that I don't think we have what's the equivalent of a heart attack. I don't think the sky is falling. And that's not in any way to minimize the problems we have, which are very real. I mean, we've got more than 50 million people without insurance. We've got rising costs. Quality's kind of uneven. These are real issues. But I think what they really resemble is several chronic conditions. It's like having a patient who has high blood pressure and has acid reflux disease and has arthritis. They need treatment. And it's not as if their conditions aren't important or significant. They are, but it's not the same kind of treatment that you would provide with a patient with a heart attack. And so I think for us, we've misdiagnosed the problem. We've tended to look at this as something that requires an immediate dramatic fix. And my basic argument is that there is no immediate dramatic fix. There is no cure, if you will. What there is a need to manage the problems we have successfully. And by talking about this in kind of a dramatic fashion, that if we don't act, the system is unsustainable, the system will collapse. I think when you look at those warnings from the early 70s, people were talking about the system collapsing in 2 to 3 years. There's a Chicken Little effect. I think what we've been doing, to use a baseball analogy, is swinging for the fences. And I think what we need to do is focus more on singles and trying to get people on base. We keep looking for a quick fix. We keep looking for the cure. And in arguing about that, one of the things we find is that different people have different diagnoses. If you talk to Republican candidates, you tend to get market-based solutions. You talk to Democratic candidates, you tend to emphasize more the role of government in terms of solving these problems. We need to focus on both the need to solve the problem, and that's something that we've often taken for granted. We talk about a crisis, but we don't talk to people about what's the nature of the crisis. And in part, what we've got is people using the same word, but they're using it differently and to describe different things. So we talk about a malpractice crisis, we talk about a health insurance crisis, we talk about a cost crisis. And different policies will address each of these, but no one policy addresses all of them. And so we need to really be much more precise in terms of how we talk about the problems we face in order to get a better treatment. Well, it's funny because people have often talked about how American politics is broken. You know, that you hear a lot of conversation about civil discourse.
Extremes.
And people, the system, we can't make change the way we need to or used to. I think if you look back in American politics, it's always been a bare-knuckle affair. I mean, there have always been people who've used character assassination, negative advertising. I think the difference today is we've got a far more pervasive media. You know, both with kind of the 24-hour news cycle and also obviously the internet. But I think compromise is still possible. I think in the short term, both political candidates and Congress has found it far more advantageous to really focus on not brokering a compromise. The political realities have intervened, but they always have.
Sure.
And I think if you look back, other issues, Social Security, deficit reduction in the early 90s, we've found ways to cut through that, and I think we can again. Well, I think that's one of the things that really struck me as I started to look at this topic in more detail. I started actually in a pretty traditional fashion. I'm a political scientist. I looked at public opinion polls, I looked at speeches, I looked at campaigns. But as I spent more time looking at it, I started to find these same themes popping up in movies, like As Good as It Gets with Jack Nicholson. ER, people would talk about a crisis of access. And they wouldn't always use the word crisis, but they would construct the drama so that it was very clear that what was happening was in fact a crisis. It was a life or death situation, that the patient had no health insurance, or the costs were being used as the way to make decisions. And I think when you look at shows, even TV comedies like Scrubs, you see great conversations about medical malpractice, about cost. You see the same thing in shows like ER and Grey's Anatomy, where they've wrestled with some of these value issues. And actually, I think the irony is TV medical dramas, I think, have done a much better job of putting the issues out there for the public than actual political candidates and public discourse has. I think we've actually raised a lot of those questions. And the funny thing for me is that as you look at the public reaction to these shows, there's been some really interesting public opinion work on this, and shows like Grey's Anatomy have been studied for what impact they have on shaping voters' views. And it turns out they have quite an impact. Around the water cooler the following day, emails, et cetera, we see a lot of follow-up on some of the themes that have appeared in TV medical dramas. And so I think that's a part of our solution. Working with Hollywood, working with producers to raise issues and to educate the public. We need to get people in a setting when they're disarmed, where they're not predisposed to filter out this as just political rhetoric. We need to talk about the issues and get people engaged in thinking about what are the trade-offs that we face. Well, I think part of the president's problem is not of his own doing. It's just the public has very conflicting expectations about what they want from healthcare reform. We want the best of all worlds. We'd like a system that provides us with affordable care, the highest quality care, and that covers everybody. No one in the world has figured out how to do this yet. And so we're not alone in that. The challenge we've got is that we made a number of compromises here. I think the president has promised cost containment, and he's also promised a dramatic increase in access. And for much of the public, this doesn't add up. The public just doesn't find this to be a credible argument. Much of what we're seeing now, in fact, is confirmation of that. Massachusetts is struggling, for example, to control costs. They're the best example of what Obamacare, as people describe it, will look like. That was essentially the model. And it's done a very good job of expanding access. The problem is it hasn't done a very good job of controlling cost. And that's not a surprise. Everybody around the world is struggling with the same issue. But I think what is unusual is that this, 2 years after it passed, is still a remarkably unpopular measure with much of the public. And I think for many reasons, one of which is that for most of the public, this does not offer significant new benefits. If you're uninsured, this is a major change. But the bill has a lot of things that a lot of folks don't like. There are cuts in payment to providers. There are cuts in Medicare to pay for some of the expansions. Those constituencies aren't happy. And I think one of the things we're seeing here is a lot of folks are looking at this and asking, what's in it for me? And unfortunately, many folks have concluded that there's not that much in it for them that benefits them directly. In some cases, there are popular measures, things like expanding access to health insurance for kids up until age 26, ends on pre-existing condition bans, and things like that. Those are significant changes, and those are popular changes. The notion of how health insurance exchanges are going to work is still being worked out. And the Supreme Court threw a wrench into things in terms of expanding Medicaid. So we're still very much waiting to see how that's going to play out at the state level. Well, teaching here at PC has been a godsend in terms of working on this book. I've had several extraordinarily talented research assistants, and I wish I could claim credit for finding all of the stuff that's in the book, but honestly, the credit really goes to them. They ferreted out most of this stuff. I would give them broad instructions saying, I need to know about how we talked about malpractice reform in the early 70s, and they'd go off and find things, come back, we'd have conversations, look at holes, look for connections. So I had, over the course of the 10 years I worked on the book, 5 or 6 really talented PC undergrads who helped make this possible. The other thing I really took advantage of, because I think our students are wonderful, is I asked students in my classes to read selected chapters from the book, particularly early on. Part of that was because I'm trying to write the book for different audiences. One of the groups I'm really targeting is undergraduates, particularly upper level undergraduates and grad students. So I wanted the book to be accessible. I wanted a consumer's view of, did the argument make sense? Is it too jargony? And the students were remarkably helpful and candid. And the book really has improved as a result of the feedback I got from our own students here at PC. I have a couple of different goals. For students, I really hope that this will help them to understand how the system came to be. By helping them to see the way we've talked about reform, and that the way we talk about reform matters. It's not just words, because the words structure our choices. And I think you really need to understand that. I also hope that people who are academics and people who are studying this issue in think tanks and other settings will look at this book as a different lens to think about reform, and to talk about the importance of public discourse. My final goal, I think, it really is thinking about how, again, civil discourse matters. The way we structure our debates is something that we have to pay attention to. And I don't think we can really get rid of negative campaigning, negative ads. What we need to do is pursue some different avenues. We need to create some new vehicles to get the messages out. And I think there are ways to do that. And I think one of them, for me, is popular culture. And I think by collaborating with Hollywood producers, other folks, writers, we can get the need for healthcare reform communicated to the public in ways that we haven't done so to date.